Today, on Health by Design Interactive, we bring you a story about virtual health coaching. It's a concept in healthcare that became more prominent over the course of the COVID 19 lockdowns. We're speaking with Dr. Noah Wayne from NextJ Health, and we'll explore how health coaching is playing a role in the lives of a growing number of Canadians. Here's your host, Greg Bish.
Hello, and welcome to this edition of Health by Design Interactive. Today, I'm joined by Dr. Noah Wayne. Dr. Wayne is the Vice President of Clinical Programs at NextJ Health. He is a registered kinesiologist and clinical exercise physiologist. He's focused his career on health psychology, particularly in motivation and behavioral change. He leads the health coaches and clinical services at NextJ Health, the provider that Manulife is working with to pilot a program that delivers virtual health coaching to selected plan sponsors and their members. Welcome to Health by Design Interactive.
Very happy to be here.
Okay, let's dive right in. For the benefit of our listeners, can you tell us exactly what health coaching is and what health coaches do?
Sure. So health coaches are health professionals who work with people to help them reach their health goals. NextJ health coaches are extensively trained in a counseling technique called motivational interviewing and have deep knowledge and experience in working with people with chronic conditions and in management and prevention. Health coaches focus their approach on helping clients identify their own, what we call intrinsic motivations for change, help them set up goals that are meaningful to them, and use evidence-based techniques and digital tools to maximize our clients' chances of success at changing their behavior and improving health.
Can you give a few examples of how health coaches work with clients?
For example, a health coach may work with a client to help set goals around stepping up an exercise program or eating a more balanced diet by reducing sodium perhaps, or trying to cut out processed foods, or adapt strategies to help manage stress by providing education and support on mindfulness. As anyone who's ever tried to set new health goals knows, it can be hard. And so working with a coach helps you break down those new behaviors into more manageable steps and gives our clients an advantage by taking control of what we call modifiable risk factors for our conditions. And now the cornerstone of this coaching relationship is a strong, what we call therapeutic alliance, which means that the interactions between the coach and the client are based on mutual trust and respect. And an important distinction between coaching and other forms of care is that in coaching, the coach works with the client to co-establish goals. And it's the client really leading the way in the relationship, and in the sessions, the coach is really just there to guide and support. The objective of these health coaching programs is to help members better manage their chronic conditions and mental health, so that for those who may be at risk of going on disability, we can help to prevent that from happening, and when people are already on disability, can help them return to work faster.
What kinds of qualifications does a health coach have?
All of NextJ's health coaches are regulated healthcare providers, and this includes registered kinesiologists, dietitians, social workers, and nurses. That clinical credentialing is really important for our coaches because many of them work with individuals that have some form of chronic condition like diabetes or cardiovascular disease, cancer, and depression. It's important that when working with people with these conditions that the coach has that experience and understanding of those clinical considerations as well, which also really includes the right time to refer a client to another clinician. And now, on top of that clinical credentialing, all of our coaches have extensive training that NextJ layers on in evidence-based behavior counseling techniques like motivational interviewing and cognitive behavioral therapy like CBT, as well as the use of digital technology that can provide a digital approach, a virtual approach to helping our clients with health behavior change.
Let's chat about the virtual part of health coaching. What does it involve, and how successful is your work when it's conducted virtually?
The thing about NextJ Health is that we don't just do health coaching, but we're also a technology company. And so we've developed an incredibly robust digital health platform that we call NextJ Connected Wellness. And this platform has been purpose designed to support health coaching and support our clients learn about their health, support them in developing new health behaviors, and improve overall activation around their health. So all of our coaches use NextJ Connected Wellness to interact with their clients. And this could include secure messaging and video chat, but also includes educational materials, allows tracking of different behaviors, all within the same platform. The platform itself syncs with over 300 different wearable and medical devices, so we actually have at our fingertips as coaches access to steps and sleep patterns, blood pressure, blood glucose, the meals people eat, and overall signs and symptoms of chronic disease. And now this ability to see individual level data and population data provides NextJ health coaches with an uncanny amount of information to support their clients to be success. We know exactly who needs support, when they need it, wherever they are. And we've proven this actually in a number of clinical research trials across a number of different conditions. We have almost 24 peer-reviewed papers describing various health coaching approaches for different populations and showing the evidence of that success.
How is a health coach different from other traditional health providers?
Well, the coach is connected to their client through the platform 24 hours a day, 7 days a week. Our clients can message their coach at any time and can actually expect a response within a reasonable amount of time. And with this wealth of information, such as on steps and meals and how they feel, the coach is empowered with so much more data when they're helping their client. And clients actually really appreciate this because it makes them feel like they have that support from their coach even when they're not on the call or in the clinic. In one of our published research studies where we interviewed clients that had gone through a health coaching program, we interviewed them about their experience. One participant referred to this as a tether with their coach, and it made them feel like they weren't in this alone. And we've had a number of anecdotal responses from participants who go through the program and who say that they feel for the first time that someone in the healthcare system was on their side.
Having someone on your side is so important to feel when you're trying to make big changes in your life, particularly around chronic conditions where you might feel alone. So that's so important. Sometimes coaches have to push their clients, though, in a good way. How do you manage that and maintain the coach-client relationship?
As I mentioned before, the coaching relationship or the coach-client relationship is the cornerstone, the essential component of really driving successful, sustained behavior change. Your coach ends up becoming the support that you need. And so sometimes you may need someone to problem solve with. Sometimes you need someone to help you break down your goals into really manageable steps so you know what the next thing you can do is to get that long-term goal. And sometimes you just need someone to keep you accountable. And so your coach adapts their approach to doing all of these things when you need them. So the base of that coaching relationship always stems from a spot of empathy and compassion and what we call unconditional positive regard. And so we're on your team. We don't judge, we don't chastise in any way. We're simply there to help you achieve your goals. And we totally understand when they don't go as planned. We're just here to help you get back on track.
Health is such a personal thing, and I imagine some clients may be a little bit nervous when first working with a health coach. How do you approach clients when they're a little bit hesitant at first?
I guess I like to try to remind people, if they're timid of trying the health coaching, that they're in control the entire time. And what I mean by that is that they can choose how much they want to engage and how little they want to engage in the overall coaching experience. So they can choose what information they share with their coach. They can choose how frequent and what kinds of interactions they have with their coach. So we have some clients who do video chat sessions with their coaches, and some clients who only do message-based coaching. And our goal is really to give the right amount of coaching for the person and not more and not less.
As we wrap up, can you share a story from your own personal experience that shows how health coaching can help patients have healthier outcomes?
A client that comes to mind is an individual I coached a few years ago who had type 2 diabetes, not managing his sugars well, and had recently had a stroke. When he started coaching with me, our focus was really on the diabetes, but what he had said was that he really missed being able to play with his grandchildren. And since the stroke, he hasn't been able to kneel down on the ground. And so we started to set up goals around exercise, and specifically balance exercises and strength exercises. And over the course of the program, helping to keep him on track with being consistent with those specific exercises, he ended up being able to kneel down and play with his grandkids. And I guess the reason I bring this story up is because I always come back to this one because it shows me how interconnected our health outcomes really are with the rest of our lives, and how the impact that those health outcomes and achieving those outcomes can have on our overall quality of life.
Well, I can really relate to that because my parents love playing with my children, so that would be a very powerful thing for a lot of grandparents.
Absolutely.
Noah, on behalf of everyone listening, we really appreciate you joining us to talk about virtual health coaching. It's a fascinating innovation and one I expect will just grow in popularity.
Thank you. It's been a pleasure to speak with you.
As a reminder to our listeners, you can find more content on organizational mental health and other workplace wellness issues at manulife.ca/group benefits. Click on the news tile and group benefits.